Are you struggling with relentless low back and leg pain, but can't seem to find a real solution? If medical terms like foraminal stenosis and lumbar stenosis and spinal stenosis leave you more confused than informed, you're not alone. In this video, we're going to clarify these different spinal conditions, revealing the crucial differences your doctor might not have even explained to you. You'll discover how each condition uniquely affects your body, the key symptoms to watch for, and the most effective non-surgical treatments available today. But that's not all. Stay tuned because in just a few minutes, I'll introduce you to a revolutionary non-surgical treatment that specifically targets the underlying causes of low back pain and leg pain, like spinal stenosis and foraminal stenosis. If you stay until the end, you'll hear the inspiring story of my patient Katherine, who found relief from her chronic back and leg pain using this unique approach. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Today I'm coming to you from my own backyard. It's just too nice a day to be in the clinic. Well, we were in the clinic all morning long, but it's time to get out and enjoy some of the sunshine. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. I upload a new video every week. In addition to that, I've created a free Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. It is free of charge. We do it as part of a community service. We've been doing this for years. You can get it at the link in the pinned comment below. So what exactly does foraminal mean? What does stenosis mean? They're all big words that you often see on an MRI. Unfortunately, they're never explained to you in most cases. Today, I'm going to make it simple. So stenosis just means narrowing. It's the same term that is used in heart disease all the time. When you actually start to narrow the arteries, you narrow the aortic valve as well. Same thing when it comes to the spine. Stenosis is a narrowing, and what that narrowing refers to is, if we look at this, okay, stenosis means narrowing. Foramen or foramen, same as tomato, is the opening. Just means opening. So if these are vertebrae, you've got the vertebrae, you've got the disc, you've got another vertebrae. The yellow thing you see coming out is the nerve. That opening, a foramen, means opening or passage, and especially when it's referring to bones. So it's actually where the nerve is, it's the opening that the nerve comes out. So that's your foramen. So if we put all that together, foraminal stenosis simply means that you're getting a narrowing of the opening where the nerve exits. So that occurs when those openings where they exit the column, they become narrowed. That narrowing can come from so many different things. Most often it's degeneration to the spine. It can come from spondylolisthesis where the vertebrae shifts. It can come from a disc herniation that encloses that opening, but in most cases degeneration. And when that happens, that narrowing is obviously going to compress that nerve that is coming out. That's going to lead to symptoms like sharp shooting pain, numbness. It can be tingling. If it's coming from the neck, that tingling is going to be in the arms. If it's coming from the lower back, that tingling is going to be in the legs. It often results, as we said, from those degenerative changes such as spurs, disc herniations, and so forth. Spinal stenosis, on the other hand, and some people call this lumbar stenosis if we're referring to the low back, or cervical stenosis if we're referring to the neck. But really it's spinal stenosis, and the difference is you're then not affecting that foramen, the opening where the nerve comes out. You're affecting the spinal canal itself, so that's where the spinal cord is inside. So now you're narrowing that spinal cord with the spinal stenosis. So that's going to involve that narrowing of the spinal canal. In this case, we're talking about the lower back. The narrowing, again, now we're putting pressure on the entire spinal cord at that level, not just the nerve exiting. That can lead to symptoms certainly like pain, definitely weakness, cramping in the lower back, the buttocks, the legs, especially during walking or standing. And unlike the foraminal stenosis, as we've said, that spinal stenosis is going to cause more diffuse pain because you're affecting the entire spinal cord and wherever the rest of those nerves are going to, as opposed to just that one specific nerve. So when you get the spinal stenosis, it affects a much wider area. So the key differences then that we're going to see between foraminal stenosis versus spinal stenosis, while both conditions involve narrowing in the spine, they are going to affect different areas and different structures depending on where those nerves go to. So in the foraminal stenosis, where we're affecting that opening where the nerve comes out, we're going to specifically affect those nerve roots, and wherever that nerve goes to, it's going to tend to cause more localized pain. Plus, wherever that nerve goes to, if that nerve goes down the leg, if it's coming from the lower back or down the arm if it's coming from the neck. In the spinal stenosis, or as some people refer to lumbar stenosis, when they talk about stenosis, they're referring more to the spinal stenosis unless they specifically say foraminal stenosis. Now you're affecting that central canal. That's going to lead to more generalized pain and mobility issues. Understanding the difference is crucial for an accurate diagnosis and targeted treatment. So knowing which type of stenosis you have helps in tailoring the right therapeutic approach, whether it's medication, chiropractic, physical therapy, exercise, whichever approach you're going to take, obviously will work better if you can tailor it specific to the underlying cause of your problem. Now, there are some key symptoms that you need to look out for. So in foraminal stenosis, it's going to be characterized by sharp shooting pain radiating down the arms or the legs, depending whether it's coming from the neck or the lower back, numbness, tingling, sometimes muscle weakness as well. Symptoms are often more localized, so they stay more in one area and can worsen with certain movements or positions. Spinal stenosis, on the other hand, is characterized by an aching or cramping pain in the lower back, the buttocks, definitely the legs, particularly after walking or standing. Symptoms may improve when sitting or bending forward because when we do that, we're taking pressure off the entire spinal cord. Now, there are potential what we call red flags. And what a red flag is that's an indication that there's something serious going on and obviously indicating that the condition is worsening as well. So if you're experiencing worsening symptoms of foraminal or spinal stenosis, such as increasing pain, numbness, tingling that spreads, or muscle weakness in the limbs, it could indicate severe nerve compression and require prompt evaluation. Red flags like sudden loss of bladder or bowel control, loss of sensation in the groin, difficulty walking or standing, suggest a more serious progression, and they demand immediate medical attention. If you ever lose bowel or bladder function, even if you're a patient of mine, please don't even bother calling me at that point. You're off to to the hospital for emergency surgery. Now, rapid onset of any of these symptoms is particularly concerning and needs to be assessed by a healthcare professional right away. Now, there are non-surgical treatment options for both foraminal and lumbar stenosis. So if you're dealing with foraminal or spinal stenosis, non-surgical treatments can effectively manage your symptoms and improve your quality of life by getting to the underlying cause of the problems. Exercise can often help strengthen the muscles around the spine and improve flexibility. This can sometimes decrease nerve pressure and alleviate pain. Chiropractic adjustments are great. They can offer relief by improving spinal alignment and reducing irritation of the spinal nerves. There are various forms of over-the-counter and prescription drugs and injections. They sometimes can be beneficial. They can provide temporary pain reduction and help decrease inflammation for sure. There's also non-surgical spinal decompression, which is a safe alternative that gently relieves pressure off the spine, off the discs, and off the nerves. Now, we'll dive deep into non-surgical spinal decompression in a moment. Lifestyle changes such as maintaining a healthy weight, practicing good posture, along with alternative therapies like acupuncture, yoga, can also help reduce symptoms. These non-surgical options all offer fewer risks than surgery. They focus on pain relief, mobility. They help to address some of the root causes of back issues without any of the invasive procedures. Now, the treatment of choice in my clinic is what's referred to as non-surgical robotic laser spinal decompression. Many people aren't even aware of non-surgical spinal decompression as a viable alternative. Unlike back surgery, which carries risks of infection, nerve damage, and the possibility of failed back surgery syndrome, non-surgical spinal decompression typically involves fewer risks and complications. The focus is on relieving pain, improving mobility, enhancing quality of life by getting to the root cause of the problem without the need for invasive procedures. Now, let's be clear, when we talk about spinal decompression, for some, that still means a surgical procedure. That's not what we're talking about. We're talking about non-surgical robotic laser spinal decompression, completely non-invasive. There is no such thing as minimally invasive. Invasive is invasive. So this unique method that we use in our clinic is that we use as non-surgical robotic laser spinal decompression. It's a revolutionary approach that combines the proven benefits of both true spinal decompression with the advanced technology of class 4 laser, all in one simultaneous treatment. So what makes the treatment so unique? Well, the innovative method is it's not just another form of therapy, it's a game changer in the field of non-surgical spinal care. There are only 12 clinics in the world that offer this cutting edge technology, and we're proud to be the only health center in Ottawa, Ontario, Canada to offer it. How it works is actually very straightforward. Spinal decompression and class 4 laser therapy, each of them separately has been shown to effectively treat degenerative spinal conditions like lumbar stenosis, foraminal stenosis, lumbar disc bulges and herniations, and sciatica. But what if these two treatments were actually combined and performed simultaneously? That's exactly what we do with non-surgical robotic laser spinal decompression. So spinal decompression gently decompresses the spine. So if you have degenerative changes that have thinned out that disc, have degenerated that disc, puts pressure on the nerve, what makes more sense than to take that pressure off the disc and the nerve? If you have a disc bulge or disc herniation that's putting pressure on the nerve, what makes more sense than to take that pressure off the disc and hence off the nerve? If you have if you have stenosis in that area, that's caused that narrowing of those openings, what makes more sense than to increase those openings? That's what spinal decompression does. It's not the same as traction. It is not the same as inversion tables. You're literally creating a decompressive effect inside the disc. So what that does is it's not only going to help to reposition, the discs and the nerves. It's what any bulging or herniated disc can actually, recede back in. It's going to facilitate the flow of oxygen and water and nutrient-rich fluids into the discs, prompting natural healing. That's what true spinal decompression is all about. Class 4 laser therapy is the highest level of laser approved for use both in Canada and the US, and it's going to penetrate deep into the tissues, reducing inflammation, accelerating tissue repair, alleviating pain at the cellular level. The laser energy stimulates the cells, promotes rapid healing and recovery. Now, if you combine both of these at the same time, the class 4 laser helps to ease up those muscles, which allows for even better spinal decompression. And the more you have better spinal decompression, the deeper the class 4 laser can get. So this is why it's so key that these two are done simultaneously. It's when these two therapies are combined in a single synchronized treatment, the healing effects are magnified. So patients experience not just fast relief from pain, but also correction of the underlying spinal issues that cause the back and leg pain in the first place. This unique combination helps stabilize the spine. It helps to prevent recurring pain. It promotes long-term spinal health. That's what we're looking for. We're looking for a long-term solution. We are not looking for temporary pain relief. And often that temporary pain relief actually allows the condition to progress whether you realize it or not. So non-surgical robotic laser spinal decompression offers that dual approach. It addresses both symptoms and the root causes of spinal conditions, leading to faster recovery and more sustainable results. It is non-invasive, it's safer than surgery, it avoids risks like infections and complications. If you've been searching for a safe, effective, and innovative solution to manage your back and leg pain, non-surgical robotic laser spinal decompression might just be the breakthrough you've been waiting for. This is exactly the approach that Katherine took. Katherine is one of our patients, as I alluded to earlier. We have given thousands of successful treatments to this point, and we have a number of stories and great results. And these are not stories per se. These are actual patients who underwent our program. Katherine is an 83-year-old woman who was suffering with significant back pain, had to use a walker at all times, and she did indeed have spinal stenosis and foraminal stenosis and multiple disc herniations and advanced degenerative disc disease. Most medical doctors at this point are giving up on you. The healthcare system is usually giving up on you. It's going to be, well, what do you expect? You're getting older and so forth. And that simply doesn't have to be. Katherine underwent one of our neurospinal restoration programs that includes non-surgical robotic laser spinal decompression. I say neurospinal restoration because then we also look at other aspects of your care as well. Everything from proper nutrition to nutrients to neuromuscular reeducation to the exact functional exercises to stabilize and strengthen. We look at the big picture, of which the non-surgical robotic laser spinal decompression is the key innovative technology. Katherine underwent an 8-week program with us, came in 3 times per week, and Katherine's results were what we see on a very, very regular basis. Katherine got to the point where not only did we help her with the foraminal stenosis and the spinal stenosis and the advanced degenerative disc disease, Katherine no longer needs to use her walker. Just amazing stuff. Everyone in the senior residence wants to know what she has done. These are the changes that we can make in people even when you're into your 80s, and the whole idea is don't wait till you're into your 80s to do this. Now, if you're experiencing persistent low back and leg pain, know that there are options beyond surgery. Today we've explored how understanding the differences between foraminal stenosis and spinal stenosis can help you better manage your symptoms. I also introduced you to revolutionary non-surgical robotic laser spinal decompression. It's a method that's changing lives just like it did for Katherine. If you've learned something new about foraminal stenosis and spinal stenosis and found value in this video, please like it and please share it. If you have a question about non-surgical robotic laser spinal decompression, back pain, leg pain, leave it in the comments section below. Remember to subscribe for more insights and strategies on relieving back and neck pain naturally without the need for drugs or surgery. The next video you should watch is the one where I show you 5 easy to do exercises to help quickly give you some relief for your spinal stenosis. Go watch the video right here next.